Hello, my name is Sam Evans, and for my sixth and final Sports Medicine 3 presentation, I was given the topic of post surgical rehab, and I decided to focus on ACL reconstruction. So, what is the ACL? The anterior cruciate ligament, or the ACL, is one of the key ligaments that help stabilize your knee joint. The ACL connects your femur to your tibia and is a common injury in athletes. It's most commonly torn during sports that involve sudden stops, changes in direction, or sudden twisting motions, such as basketball, soccer, tennis, and volleyball. So, what are some major risk factors for an ACL injury? For starters, we have just being female. Typically found, women experience more ACL injuries than men in sports, possibly due to the difference in anatomy, muscle strength, and hormonal influences. A few other risk factors we have are participating in high risk sports, poor conditions, wearing footwear that doesn't fit properly, using poorly maintained sport equipment, as well as playing on artificial turf surfaces. So, what are some different types of ACL reconstruction? So, when a patient comes in after an ACL injury and they're looking to get ACL reconstruction, they must first decide if they want an autograft or an allograft. An autograft is a patient's very own tissue. It is the safest and fastest healing tissue that can be used. However, harvesting autograft tissue creates a second surgical site from which a patient must recover. The additional recovery time can extend a patient's hospital stay. In addition, the secondary site could be uncomfortable for years after the surgery. Under an autograft is highly recommended for people who are under 25 or 30 years old and are highly active. It is recommended for this age group just because they have a 5 times lower likelihood of tearing it again. Next, we have an allograft. Allograft tissue is taken from another person or a cadaver. It typically takes longer to incorporate into the patient's body, but there is no second surgical site to heal. Also, the surgical time and hospital stay may be shorter when an allograft tissue is used. Allografts are highly recommended for people that are over 40 years old and have moderate to low activity. If a patient picks an autograft, they then have to decide if they want a patellar tendon autograft or a hamstring autograft. When a patellar tendon graft is selected, the central 1/3 of the patellar tendon is removed, about 9 or 10 millimeters, along with a block of bone at the sites of the attachment at the kneecap and tibia. This method is most common in high-level athletes. Some advantages of the patellar tendon graft is that the length of the patellar tendon is about the same size as the ACL, and the bone ends of the graft can be placed into the bone where the ACL attaches. This allows for bone-to-bone healing, something many surgeons consider to be stronger than any other healing method. Some disadvantages of a patellar tendon graft are when it is taken, a segment of bone is removed from the kneecap and about 1/3 of the tendon is removed. There is a risk of patellar fracture or patellar tendon tear following this surgery. In addition, the most common problem following this surgery is anterior knee pain. Next, when hamstring tendons are used in ACL surgery, one or two of the tendons of these muscles are removed and bundled together to create a new ACL. Some advantages of this method are it's less painful moving forward, like later on in life. And some disadvantages are that the main problem with these grafts is the fixation of the graft into the bone tunnels. With the hamstring grafts, a longer period of time may be necessary for the graft to become more rigid. There is also a slightly higher chance of ACL failure, but barely any. Next, we have the bear technique. The bear technique, or the bridge enhanced ACL repair implant, is a bioengineered bridging scaffold to help with the healing of the torn ACL. The bear implant is designed to be surgically placed between the torn ACL ends at the time of repair, and to hold a small amount of patient's blood in the wound site. The combination of the bear implant and the patient's blood provide a scaffold that allows the torn ends of the ACL to heal back together. This technique is considered to be the future of ACL reconstruction. Rehab timeline. So, within the first 1 to 14 days, our main focus is going to be pain control, swelling control, full knee extension, as well as mastering crutches. Within the first 2 to 6 weeks, our goal is to minimize swelling, increase general fitness, as well as begin to walk normally. Within weeks 6 to 12, our main goal is to increase strength, work on proprioceptive work, as well as preparation for the next stage. Months 3 through 6, in this phase, we want to focus on strength work, advanced proprioceptive work, running, as well as sport-specific activities. In months 6 through 9, in this phase, our main goal is to improve fitness, improve strength, improve proprioception, as well as to return to sports training. And finally, in months 9 through 15, we begin actual sport, not just training, as well as continue to train the knee. This timeline can alter depending on age, activity level, as well as if the patient got an autograft or an allograft. If they got an autograft, they have to spend a little more time in the beginning stages of rehab just due to that second incision site. They have to really focus on that so it doesn't cause problems later on. If the patient got an allograft, then the allograft takes longer to incorporate and create a new blood supply because the body sees the tissue as foreign. So a patient might have to spend a little more time early on or middle of rehab. Thank you for watching.